Kidney disease is an increasing problem where you live. And in this video, I'm going to tell you 10 early signs that you may have kidney disease. And then at the end of this video, I'm going to tell you which lab work to ask your doctor for to thoroughly evaluate your kidney function and make sure that you don't have early kidney disease. I'm Dr. Ken Berry, a family physician with over 20 years of clinical experience. Let's talk about kidney symptoms that you might miss. One of the big things you need to understand about symptoms of early kidney disease is that they are very subtle and they are very generalized. Almost never are you going to have pain in your kidneys if you have early kidney disease. It's not that blatant. So let's go through these 10 signs and I'll explain each one to you and what to look for and what not to worry about. Number one is you may be more tired, have less energy, or even trouble concentrating if you have early kidney disease. This is a very subtle symptom. This could be associated with 100 different things, but it can be associated with early kidney disease because one of the major functions of your kidneys, although they do hundreds of things, is that they filter waste and toxins out of your blood. And if these toxins are starting to build up, one of the ways you might notice that is with being more tired, less energy, less get up and go, and trouble concentrating. Number two, you might have trouble sleeping. Now, again, this could be associated with many things, but it can also be associated with early kidney disease. The buildup of toxins, once again, can make it difficult for you to get to sleep or to stay asleep. Number three, you have dry, itchy skin. Now, millions of people have dry, itchy skin in the coldest months of the winter, if you live somewhere where winter is a problem. But if you're having dry, itchy skin all year round and you can't really put your finger on a cause of that, it could be early kidney disease. Number four, you feel the need to urinate more often, or you feel like you need to urinate and then you go and urinate and it wasn't really a lot of urine. This can be a sign of early kidney disease. Another associated sign is that you'll notice foamy urine. So this can be confusing for a lot of people because virtually everyone, when they urinate, if the velocity of their urine stream is strong enough, it's going to make some bubbles in the toilet, okay? Just because you made bubbles doesn't mean you have foamy urine. Foamy urine sticks around, and so after you urinate, there's foamy bubbles, not just a few scattered bubbles, but lots of foam on top of your urine, and it stays there for several minutes. This is a sign that you're spilling protein from your kidneys and you probably have early kidney disease. Another early sign of kidney disease is that you notice blood in your urine. This is for many people the very first sign that something's going on with their kidneys. If you notice that, you need to go see your doctor immediately. If you have any three of these 10 signs, you probably need to go to your doctor and get some blood work and urine check to check for early kidney disease. But if you have blood in your urine, that's an immediate trip to the doctor. The next is that you're experiencing persistent puffiness around your eyes for no real reason. Now, if you didn't sleep good the night before, or if you're having allergies, you might have puffy eyes. That's probably not your kidneys. But if you're noticing persistently puffy eyes for no real reason, this can be an early sign of kidney disease because one of the other jobs of your kidneys is to partition and move water around in your body where it needs to be. And then also the toxin buildup as well can lead to puffy eyes. Another is that your ankles and your feet swell for no apparent reason, especially if you stand on your feet, if you take a long car ride or a long plane flight. If you notice that your ankles are puffy and they didn't used to do that, that could absolutely be a sign of early kidney disease. Another sign is that you may notice that your appetite's just off. You're not as hungry as you normally are. The buildup of toxins from early kidney disease can absolutely put off your appetite and just make you not as hungry as you normally are. And then number 10 is that you notice an increase in the frequency of having muscle cramps. One of the other things that your kidneys is they regulate your electrolytes and keep the electrolytes in your blood balanced. And if you have early kidney disease, then you can have problems with holding on to extra fluid, but also with muscle cramping. Now, let's talk about the labs that you need checked when you go to your doctor, if you have 3 or more of these symptoms, number one is a lot of people worry about their BUN or their BUN to creatinine ratio, and these are very generalized labs. They very often have very little to do with overall kidney function. You want to focus on your creatinine. You want to focus on your estimated glomerular filtration rate, or eGFR. And you want to focus on if you're spilling protein or albumin into your urine. And there's also a specific ratio your doctor will look at called your urine creatinine to protein ratio, or albumin to creatinine ratio. These are the labs that will tell you if you have early kidney disease, and if you do, how advanced it is. If you want to know more about what causes kidney disease, I've got a video that you can click and it'll tell you more about what's causing kidney disease. And if you start changing these things right now, you could actually prevent kidney disease in the future. Hope this video helped you a lot. This is Dr. Barry. I'll see you next time.